Okay, so we're just going to review everything that we went over today. Each night, like, set your timer for about 10 minutes. You're going to do 5 minutes of an abdominal massage. You're going to do a few minutes of some deep breathing, and then you can do some of the exercises throughout the day whenever it works for you. So for the abdominal massage, what I want you to do is, you'll be laying down. I'm just going to show you in seated position for right now. You're going to start on your left lower side, so kind of find your hip bone, come in. You're going to work through a little circles here. You're going to go across to your other hip. You're going to come all the way up. You're going to work all the way around. So you always want to work in a clockwise direction when you're first doing your abdominal massage. This will encourage like any bowel movements, any gas to be relieved. Your sigmoid and descending colon sit on the left side. So that's why we always want to warm up here, so that whatever we are moving has a place to exit. So spend a little time just kind of rubbing through. Then what I want you to do is really like tune in and hone in on reconnecting with your belly. So I want you to kind of grab either side of your stomach and just kind of bring everything together. So you're approximating left side and right side. This helps with any type of diastasis. Sometimes when the skin is separated and the tissue is separated for so long, it has a hard time reconnecting. So by forcing it to reconnect, you're kind of reminding the tissue like, hey, we should be closer together. So just kind of like, you can make a little fist and just kind of pull. You can push one side, push the other side, just kind of like make the sides kiss a little. Spend some time where you feel maybe a little achy, or maybe a spot that you feel a little uncomfortable. Doesn't mean dig into it, just spend more time there. For the deep breathing, you'll be laying down. You can also put like the wedge or the pillow under you to elevate your hips, kind of let gravity pull any type of prolapse or anything down upward and give you some relief. Hands will be on your ribs. You're going to hug your ribs with your hands. As you inhale, you're going to expand your ribs. Remember, the ribs are moving three-dimensionally. So the ribs are moving forward, laterally, and posteriorly backwards. So you're going to wrap your hands here. You're going to gently inhale through your nose and exhale, belly button towards your spine. Gentle. Remember, everything is gentle, so you don't want a huge inhale where you're forcing it and forcing it. You really want that nice gentle inhale, and you really want that exhale to be complete. So again, inhale, try and quiet your chest, try and quiet your shoulders. So you don't want to see this whole body movement as you're breathing. You really want to focus on your ribs moving. So inhale, and then exhale. Inhale through your nose, exhale through your mouth. And you want to do that for about another like 3 to 5 minutes at nighttime, or throughout the day, like anytime you have a chance to check in. The other thing we talked about was putting the ball between your knees. You're gonna lay flat, head supported, nice position. You can also do this with your hips elevated or with a wedge underneath you. I'm gonna keep it here just because it feels really good. So hands on your ribs. As you inhale, you're just resting, bringing awareness to your rib cage and your belly. As you exhale, you're going to gently squeeze the ball. You're going to let your belly drop down. So inhale and then exhale, squeeze the ball. You're going to envision your pelvic floor coming together and lifting up. Inhale, and then exhale, squeeze the ball, belly drops down, and everything is lifting up. And you'll want to do about like 20 to 30 of those each night. And then we're going to go from there onto hands and knees. This is the no cat-cow tabletop position. So you're going to just align yourself nicely here. Inhale, let your belly drop down. Exhale, pull your belly up. Inhale, drop down. Exhale, pull up. You're going to repeat that about 20 times. If this feels really easy, you can also incorporate some arm movements. So as you exhale, you're going to incorporate the arm movements. Inhale, exhale, inhale, and exhale. And again, you'll just do like 20 of those, so 10 on each side. And then remember, just kind of check in with me. Let me know how you're feeling after a week of doing all of these pretty consistently. Spend time each night giving yourself that TLC, restore your pelvic floor, restore some inner peace through your pelvic floor as well, and reconnect with your abdomen, reconnect with your body, and just pay attention. Anytime you feel like you are seeing doming through the abdomen or that loafing, really think about like that position we were just in, pulling your belly up and lifting, so pulling together and lifting up. Remember the tip I said, like at the sink, you can stand up against the sink, inhale into the sink, and exhale, pull away. Inhale, and make sure you're getting that exhale. Try not to hold your breath ever. All right, and then, yeah, check in. Let me know how you're doing.